One of the biggest things that would help immediately is for Virginia to pass Medicaid expansion. It would immediately address the uninsured, 400,000 uninsured Virginians, and it would address this by just taking back the money we're sending to Washington. Right now, we have the worst of all worlds. The Congresswoman voted against Medicaid expansion. I think that's just misguided, and it shows a breathtaking lack of understanding of budgets and economics. The other thing that we now have the Affordable Care Act. The Affordable Care Act has addressed the access issue. In 2005, we had 47 million uninsured Americans. We now have 20 million more insured Americans. We need to do more work on the cost side. We need to fix this bill. It's not perfect, and it does need to be fixed. And this is the kind of bipartisan work we need, not voting to repeal it without any sensible replacement 65 times. That is a total waste of time. Not only are they working less than half time, when they're there, they're taking silly votes, like repealing a major piece of legislation rather than finding ways to make it better.
Thank you. Congresswoman Comstock, 90 seconds.
Okay, well, I guess that's at least improvement. We aren't hearing that Obamacare has made health care more affordable. But we do see the exchanges are collapsing around the country. We see that the premiums are skyrocketing and deductibles are skyrocketing. If you have a $3,000 deductible and you are somebody who is of modest income, you don't have, in essence, access to health care. So we need to change that. I do think we need to buy across state lines. We need to be able to have health savings accounts so people can save and put their money aside when they're young and have that there for later or for their families. We also need to be having more community health centers, and I've endorsed and supported and voted for having more community health centers like we have throughout our community that provide sort of one-stop shopping for low-income people. Doctors like to come in and they're helping, they're providing charitable care, but it's a place where they can go and not just get health care, but also get family planning. They also get WIC packages and all kinds of primary services. And that's what we've done. So we need to have, Obamacare was totally partisan. Not one Republican voted for Obamacare. So what we need is to have bipartisan solutions where you sit down and work with people across the aisle and get it done. People pleaded with the president at the time to do that.
Thank you. Ms. Bennett, 60 seconds.
You know, there's another healthcare issue that we feel acutely here in Northern Virginia and across the country, and that is the opioid and heroin problem. Congress has passed a bill, but they haven't funded it. The administration asked for $1.1 billion in funding to really address this crisis that we're seeing in the country. And I believe they passed $37 million finally in the continuing resolution. This is the kind of legislating we need to stop doing. We need to, when we pass bills, if these crises are happening, we need to address them quickly, and we need to get them the adequate funding they need to really solve the problem. Zika was another one. It finally got funded, but we had a Zika crisis this summer, and not only was it not addressed in this Congress, but they took off for 5 weeks and didn't address it. Finally, there was a bill passed this fall, and funding was put in the continuing resolution. In the meantime, people were suffering. Children were being affected. Our Congress has to do better than that.